coming.
Thank you. Good evening, everyone. Thanks for coming and raising the elements to be up here. And I want to also thank Sunita, who helped me to arrange this presentation. She does the meditation kind of,
The sky breath.
the sky breath and so forth here. Highly recommend it for everybody. Just to give you a brief introduction about myself. My name is Michael Berger. I became interested in this field of traditional Chinese medicine through the study of martial arts. I was living in Japan in the 80s for about 4 years training over there, and I had an injury, and I had remarkable success with acupuncture and Asian medicine. So later on, quite a few years later on actually, I always had in the back of my mind that I was going to go to study this. And I began studying in Los Angeles in about probably 2005. And then in 2008, I made a visit to China. My brother and I went over there to visit. I had a dream or a goal that I wanted to go to Huangshan, Yellow Mountain, on my birthday. So we went there and came back, and while I was there, I visited Hangzhou. It's a city not far from Shanghai, one of the most beautiful cities in China. And I met a very, very good Chinese medicine doctor there. I had already been studying for 2 or 3 years in Los Angeles, but he let me follow him in the clinics and so forth there in China, and he said, if you really want to learn Chinese medicine, you need to move here to study. So I went back to Los Angeles, left all of my things there, left my apartment, left my car, left my karate business where I was teaching karate. I subleased my apartment to somebody, and I moved to China. So I ended up staying there for about 4 years. I did a master's degree program. Later on, went to Nanjing and completed all the curriculum for the PhD program, but due to COVID and several other factors, I was not able to complete the dissertation for that. So that's kind of how I got here. I now have a clinic in Salt Lake in the Mill Creek area, and I also practice a little bit. I have a house in Florida out there. So I'll give you a short introduction to this subject about what acupuncture and traditional Chinese medicine is and why we should use it. And then at the end, I'll allow anybody to ask any questions, and we'll kind of go from there. Okay? Okay. So let's see. So first I'll go into a brief history of Chinese medicine. So Chinese medicine likely began during the Shang Dynasty. We have evidence of bloodletting much earlier than that, but most records indicate that it began during the Shang Dynasty. That's the 14th to 11th centuries BC. The Huangdi Neijing, that's the Yellow Emperor's internal classic. That's kind of like the ancient, kind of like, quote unquote, the Bible of Chinese medicine. It's a really excellent book about not only traditional Chinese medicine, but about lifestyle and long life and different kinds of things like that, all about health and life. Most believe that was written around the 1st century BC. Most of the other remaining really important Chinese medicine texts were all written by the 4th century AD. Now some of these, like the Shanghanlun, Nanjing, Mainjing, they were written by very, very famous doctors, very famous Chinese doctors. There are statues of them all over in China, these great traditional Chinese medicine doctors. So the great achievements continued through these other dynasties, the Sui, Tang, Ming, and Qing dynasties, some of the world's most top physicians. Now, I'm often asked, some people say, well, we don't have a lot of evidence about Chinese medicine working and so forth, but some of these doctors, like Ye Tianshu and some of these other famous Chinese medicine doctors, They had case studies, thousands of case studies that were recorded with their success. So now we go to the history of Chinese medicine in the United States. So acupuncture was actually first mentioned in 1822 in the United States. So it's been here for a long time. You can see some of the books that it was mentioned in, even North American Medical and Surgical Journal on his use of acupuncture to treat low back pain, a very, very common thing that we treat with acupuncture. 1888, Doc Hay was credited with the introduction of Chinese medicine to the USA. He had another friend who opened a Chinese herbal medicine shop. Now, some of these people were here in the United States as immigrant workers working on the railroads and so forth here. But so in their small Chinese communities, they were practicing what they had brought back from their countries. Otherwise, it was relatively unknown until a very famous event happened in 1971. New York Times journalist James Reston, he was going to, I don't know if you remember, but when President Richard Nixon made the historic trip to China in 1972, James Reston, a reporter, went to Beijing before President Nixon. He had an acute attack of appendicitis, and while he was there, he had to have the appendix removed. During his recovery, he was in tremendous amount of post-surgical pain, and he underwent acupuncture, and it was just remarkable for him. And so this kind of brought to light acupuncture because he was a famous reporter, so it came out in a famous magazine article around 1972. So the first legal acupuncture center was opened in Washington, D.C., 1972. 1976, the FDA approved acupuncture needles. 1997, National Institute of Health. 2003, World Health Organization approves of acupuncture and traditional Chinese medicine. And 2006, the National Center for Complementary and Alternative Medicine was formed. And these are some more recent kind of status. Right now in the United States, about 48 states, plus the District of Columbia, require the passage of the NCCAOM. Now that's the National Certification Commission of Acupuncture and Oriental Medicine. I'm on a subcommittee of that organization. So that's an organization that regulates the testing and the licensure in 48 states in the United States. So that was, now today we have about close to 35,000 diplomas. Those are licensed acupuncturists by the NCCAOM in the United States. There are other people practicing acupuncture. Now some of you may know, I have patients coming to my clinic all the time. I had acupuncture. It was from my physical therapist, or it was from my chiropractor. So I just want to educate people as to the difference. The NCCAOM requires a college program, a master's degree program. It's at least a 3-year program with thousands of clinical hours. The people who are practicing as chiropractors, physical therapists and so forth, have a very, very abbreviated program. Sometimes as short as like a weekend course, okay? So when people come into my clinic and they say, well, I tried acupuncture and it didn't work. So I tell them, well, I had a bad haircut once and I went and tried another place. you know. They were all licensed too. So just be aware of the difference in education. So right now, we have acupuncture included in most of the top ranking hospital systems in the country and in the world, including Mayo Clinic, Harvard University, Cleveland Clinic, Johns Hopkins, MD Anderson Cancer Center, even locally at the Huntsman Cancer Center. Some colleagues of mine are doing acupuncture for cancer patients there. So it's in all of the major and most prestigious hospital systems in the country and in the world. So these are some of the treatment methods that traditional Chinese medicine uses. Tonight we're going to focus primarily on acupuncture, but these are some of the other areas that are included in the realm of traditional Chinese medicine. So we have acupuncture, we have moxibustion. Moxibustion is a warming method that uses one particular herb. It's called mugwort in English, Aiyet in Chinese, and we use that for warming and nourishing by burning that herb in different methods. Then we use tuina. Tuina is a kind of a medical massage / physiotherapy. So we learn chiropractic adjustments, we learn different kinds of forms of medical massage, and in China there are whole departments in hospitals. So, for example, if you go into the U of U hospital here, and you walk in and you look at the board of all the departments, when you do that in China, in the provincial hospitals, you'll see oncology, you'll see orthopedics, you'll see acupuncture, you'll see tuina, you'll see Chinese herbal medicine, all integrated into the hospitals, into the big, large hospitals. Okay, so then we use Qigong. Qigong is another, some people may be aware of it. It was originally called Daoyin, and it's a kind of a series of Tai Chi-like exercises. It's actually much, much older than Tai Chi, but those are exercises for health and longevity. And then we use food therapy. We use cupping, which many of you might have had. We use what's called gua sha. Someone came to me the other day and they said, oh, my chiropractor's been doing a grating scraper or something like that. Some of the Olympians have used it. It's basically gua sha. It's very old. Okay, they use it in China. They use like an ox bone for kind of a massage type of therapy on there. So the principle of Chinese medicine, this is one of the great doctors I spoke of earlier, named Ye Tenshu, and he said, someone asked him, wow, you're such a great doctor. And he said, no, I'm an average doctor because I treat the patients after they're already sick. My brother is a greater doctor because he has no sick patients. So there's a saying in the Chinese old books that says, a superior physician has no sick patients. So we're treating impending disease. If you treat disease and illness when it's already there, it's much more difficult to treat than if you treat it before it manifests. So that's why, I'll tell you a quick story. One of my colleagues, one time, he was going to school in Los Angeles, and he was doing like his internship with a very old lady doctor. And he was seeing a patient that had neck pain. And he had consulted with her and so forth. And then his mentor, the old lady, hadn't been aware of what she was there for. And she went in and sat down at the lady, and she felt her pulse and looked at her tongue, and she said, oh, you have the flu. Let me get you some medicine. And she looked at my friend, she said, I don't know what she's talking, I don't have the flu, that's my head. And he said, I don't know, she's a really good, famous doctor. Do you want the medicine? No, I don't want it. I feel fine. So he told the lady, she said, she doesn't want it. Okay. 2 days later, the lady called and she had the flu. So the principle is to treat the disease before it manifests. So these are some of the fundamental concepts. Chinese medicine, what kind of really attracted me to it was it's a kind of a synthesis of many fields: philosophy, mathematics, natural laws, astrology, emotional medicine, spiritual things, and fundamentally like the laws of nature. So it made sense to me because the laws of nature are kind of uncompromisable, and we are kind of a microcosm of the great macrocosm. So we're subject to all the same laws. That was what appealed to me about it. So some of the things we look at as disharmonies or imbalances between yin and yang, the 5 phases, qi, blood, essence, spirit, zang fu, these are organ systems, channels, and interactions between the body, the environment, and the cosmos. So seasonal kinds of things, we're subject to the same laws. Some of the treatment principles are we want to restore the balance, restore the homeostasis, and also by treating the root and the branch. So one observation about Western medicine is oftentimes their focus is on treating just the symptom and not the actual root cause. Okay? Has anybody ever experienced this? Okay, so when they'll give you a medicine and they'll say, yeah, maybe I'll feel better, but it's not treating the real reason for it. So we talked about the microcosm, and we have a different diagnostic model. So as we talked about during the history, Chinese medicine has a very, very long history of success. So at least over 5,000 years of success. And it's actually practiced by more people worldwide than allopathic medicine. So more people, so sometimes people say, oh, that's alternative medicine, complementary medicine. Well, it's practiced by more people worldwide than allopathic Western medicine. So now we'll say, why use acupuncture? Oh, okay, we've got this one too. These are concepts of acupuncture now, concepts of acupuncture. So acupuncture is based on 14 primary channels. 12 of them are related to organ systems, and then one is called the Du Mai and one is called the Ren Mai. So they're related to organ systems, like lung and large intestine, spleen and stomach. So we have channels that relate to those organ systems. There are 361 main acupuncture points, countless other ones. All of those points have very specific indications. And there are things like point prescriptions, how the point prescriptions work together, and so forth. So there are many kinds of subsystems of acupuncture, different kinds of styles. There are microsystems, like just treating the ear. Some of you may have heard of just ear acupuncture. So just through the ear, a Frenchman by the name of Nogier was responsible for really bringing ear acupuncture, auricular acupuncture to light. And it's a microsystem. There are portions of the ear that relate to every body part and every body system. You can treat just in the ear. Some other things that are very popular for the ear are like addictions, any kind of addiction problems. Many hospitals and addiction centers are using auricular acupuncture now. So those are all kind of different kind of subsystems, and there are many of them. So why should we use acupuncture? Well, acupuncture is low risk. It has very few side effects with a qualified practitioner, and has very high success rate. It's highly regulated, so it's regulated like in the state of Utah by DOPL, by the licensure board. It's regulated by the NCCAOM for regulating that you've completed the necessary education, completed the national exams and so forth. Its effectiveness, it's been studied for over 60 years, over 13,000 studies in 60 countries, recommended by medical experts, over 2,000 positive recommendations for 204 health conditions over a 27-year period. So anybody can go on to PubMed or any kind of place where there are reputable clinical trials available and find out how legitimate acupuncture is. So it's one of the most widely used medical treatments, and we mentioned it's recognized by the World Health Organization and all of these various universities, and including the U.S. military. Acupuncture, so we can look at acupuncture head to head. So there have been some comparative studies that showed meta-analysis. Now, meta-analysis is looking at a large group of clinical trials and analyzing those trials. So meta-analysis comparing the physical treatments for such things, osteoarthritis of the knee, found that acupuncture had the largest effect compared to usual care in the conditions evaluated, outperforming exercise, sham acupuncture, and weight loss. Another one in 2015 looked at shoulder impingement syndrome, found that acupuncture was the most effective adjunct treatment out of 17 different interventions, outperforming all of the others, including steroid injections, NSAIDs, and ultrasound. Then in 2016, they compared sciatica. Sciatica ranked acupuncture as the second most effective after the use of biological agents, outperforming manipulation, epidurals, disc surgery, opioids, and so forth. So some of these conditions, now I know also the National College of Physicians, their first recommendation for low back pain is acupuncture over anything else. These are some trends. So there's a lot of research going on with acupuncture. Been research for about 60 years. Cancer care, as we mentioned, MD Anderson, Huntsman Cancer Institute, many others across the country. Integrative medicine, U.S. military, and hospital-based acupuncture. So even in the major hospital systems now have acupuncture departments. We need to get it here in Utah. So what are the concerns with the current medical treatments? Current allopathic Western medicine. Has anyone here had any experiences or any concerns with your current kinds of protocols, pharmaceutical drugs? Anything that you would like to mention? Are you happy with it?
I think the doctors would just say, here, take this pill, come see me in a few months.
Yeah.
Right?
Yeah.
It's
Yeah.
basic.
Yeah. How about side effects?
Always.
Anybody experienced any side effects? So this is a problem. These are just some notes I jotted down. I think big pharma is often driven by financial gain. Sometimes rigorous testing and clinical safety is compromised. Sometimes they shortcut the whole process for FDA approval and so forth. Sometimes the side effects are worse than the condition it was treating. Sometimes there are contraindications with drugs. Maybe you have multiple doctors. One doesn't know that you're on this and one has you on this, and they mix and they create problems. Sometimes there are serious and lasting consequences of medical error. Actually, medical error is probably one of the top 5 largest causes of death in the US right now, medical error. So acupuncture is very safe, very low risk, and very successful. Also comparatively low cost. So this is a quote, and it said, while harms from appropriately administered treatments are prevalent, harm and death from medical error are rampant. According to a recent review published in the British Medical Journal, medical error is the 3rd most common cause of death in the US, with 250,000 deaths in 2013 alone. So this is a few years old, but I suspect that trend has continued. A lot of people ask me, how does acupuncture work? How does it work? Some people don't care. Hey, as long as it works, I don't care how it works, you know. But some people want to know, so I can explain it in 2 ways. Before I get into all the science side here, we can talk about the Chinese medical model. And the way it works there is they say that as long as the body is in harmony and that all of those channels are in harmony and free-flowing with qi, they say, 静若畅通百病不生. That means as long as all of the channels are free and clear in harmony, 10,000 diseases cannot be born. So that would be, we would treat according to natural laws, like deficiency or excess, dry or damp, hot or cold, yin or yang. These kind of simple things are the way that we diagnose and then treat accordingly. That's the Chinese medical model. The reason that model exists is we don't even have to know the name of a disease to treat it. We don't even have to be able to identify it. So a good example of that was H1N1, or even the COVID, when that happened. H1N1, before it was even identified, it was being successfully treated in China. It was the only thing that was successful in treating Chinese herbal medicine. We just treat according to these fundamental laws and this method of diagnosis. Now, the other way is Western science. People used to say a few years ago, well, there's no science that proves it. Well, now we do have science that proves it. So here, we have numerous physiological and biochemical changes occur during acupuncture. So we have measurable changes in the bloodstream. We can measure white blood cell count, red blood cell count. We can measure immune system function following acupuncture needles. So I worked for a period of time at the Olympic Training Center in China, and one of my colleagues there worked with the athletes and would do pre and post event acupuncture. So pre-event acupuncture would stimulate more red blood cell production. So this would enhance their performance, more red blood cells. We have Sensory nerve pathways involving specialized nerve fibers, the descending nervous system. We've mapped all of these things. Central nervous system effects, including functional MRIs that measure brainwave activity. We have changes in the visceral organs, muscle relaxation. We have increased microcirculation of blood. We have limbic structures that affect stress and illness, while improving regulation of the HPA axis. That's the hypothalamus, pituitary, and adrenal axis. So it regulates neurohormones. I was speaking with someone earlier today about insomnia, and we can actually affect sleep-wake cycles measurably by measuring the difference in neurohormones, serotonin, melatonin, and so forth, GABA, endorphins, and enkephalins. These kinds of neurohormones can all be affected by acupuncture. One of the other big ones that plays a direct one is it's a process called purinergic signaling. It's a system of the body using adenosine and ATP for signaling and regulation of tissues and all organ systems. So these are kind of complex scientific terms, unless you're into that field. But the bottom line is these things play a central role, even in things like cancer, autism, Alzheimer's, cardiovascular disease, endocrine function, gastrointestinal disorders. All of these can be scientifically demonstrated and affected by acupuncture. So here's a summary. Traditional Chinese medicine, it's a comprehensive, proven, safe, and effective medical system with a long history of proven success. Used by more people worldwide than allopathic medicine. It's recognized and utilized by the top major hospital systems, as we mentioned. The World Health Organization. We are able to address the root cause of many difficult disease patterns. So a lot of things that are best treated by acupuncture are things that Western medicine just kind of gives up and they throw their hands up. They're like, there's nothing more we can do. Has anyone had that experience? Have you? With the condition? Oh yeah, yeah. Sometimes people say, nothing more we can do, that's it.
Yeah.
No.
Empty pockets.
Yeah. So we can still try to treat, and I've seen some amazing results in my clinic and in China. Okay. Complete paralysis, stroke victims, so forth. One of the top ones that Western medicine is not very good at treating is migraines. Migraines, I have some physicians with migraines who come to me. There's nothing, there are some disease patterns that Western medicine just like, nothing more we can do. Generally, those are the things, they come to me because they're all out of options, you know? And ironically, we can help them. So those kinds of things are very good for acupuncture use. It is covered by some insurance, depends on your insurance and your provider if they're in the network. And basically we have low risk and high success. Those characters mean 谢谢. That's me sitting at a temple that my brother and I first visited, called the Jingshan Temple in China, and that's me sitting there in meditation by a large stone that was purportedly split when a monk sitting there during the Tang Dynasty became enlightened, and he screamed in his jubilation and split the rock, the boulder.